Hi, welcome back to my channel. If this is your first time here, my name is Sarah and we talk about life with metastatic cancer. I have metastatic breast cancer, and the type of cancer that I have is uh, it's called invasive ductal cancer, stage 4. That's what metastatic means. And mine is grade 2, which means it's kind of a slow growing cancer, but it's serious. It's moved into my lungs, and I have small nodules of secondary breast cancer in each of my lungs. So that's my situation. I'm currently living with it. And today I want to talk about the medications that I take on my chemo cycle. Uh, People who are on chemotherapy are usually on a chemo cycle, and everyone's is probably a little different. So if my chemo cycle doesn't sound exactly like your chemo cycle, that's okay because everyone's chemo cycle is set up to be what they need for their type of cancer, right? So anyway, the type of chemotherapy that I take that I'll be talking about today is an oral kind of chemotherapy, which is becoming more and more frequent, I think, in cancer treatments. We're starting to hear more about cancer patients taking oral chemotherapy, and some oral chemotherapy is real serious and you need gloves to handle it and so forth. But I'm on a much more gentle version of chemotherapy that I take almost daily. And I've been on this chemotherapy and I've been on this cycle, in fact, this entire chemotherapy cycle for about 2 years since early 2020, around midway through there, through that year. So the first drug I actually want to talk about before I start talking about chemotherapy is a drug that I never get a day off from. This is a drug that is not really, it's part of the cycle, but I am on it every day. I take it every morning. There's no time off. There are no breaks. So I guess I just include it as part of my daily routine, not thinking about it as part of the cycle, but technically it is. It is part of the cycle because it kind of gets things started. I had to start this before I started chemo, I think. So the first one that I was started on was called Anastrozole, but that started causing some body aches after about a year and a half, which is pretty common. So my oncologist's physician's assistant switched me over to something that's very similar. It's called Letrozole, and then less body aches. So that kind of helped with that. But what these drugs do, and I don't take them at the same time. They're supposed to be taken separately. So you're on either one or the other. And what anastrozole or letrozole does is it helps your body so that you're not producing estrogen. And this is because my breast cancer is what's called HR positive breast cancer, and that means hormone receptive cancer. So body is, or my type of cancer is reacting well to treatment that is hormonal, and that's what this is. So this stops my body from producing much estrogen. And in a nutshell, that's pretty much all it does. Um, so I take this daily. Like I said, it's every morning, and basically it just if you if you haven't already gone through menopause, this is what's going to kind of help you get there on that track. So that's an estrozole and or letrozole that you would be given for that. Okay, so that's those two. So setting the letrozole, the one that I'm on, setting that aside, we're going to start with week 1 of the chemo cycle. So week 1 would be where my Ibrance arrives in the mail from a specialty pharmacy because none of the local pharmacies are oncological pharmacies or oncology pharmacies. The oncology pharmacy that I use is out of state, so they have to ship my Ibrance, my chemotherapy, to me. I get the Ibrance in the mail, and then I usually start it on a Saturday. I did this at first because I wasn't sure how I would react to it, so I wanted to do it on a weekend when my husband would be around and everything. But I reacted fine to it, so I suppose I just stick to that schedule now out of ritual. So anyway, uh, I use the Ibrance. It's 125 milligrams. It's one tablet once a day for 3 weeks. At the beginning of the 3 weeks, like the week one, I feel pretty chipper. I feel like myself. I don't notice too many side effects other than maybe some dryness in my mouth, that kind of thing. Honestly, I with this chemotherapy, I notice the hormone treatment more than I notice my chemotherapy treatment, if you can believe that. So, this is very gentle chemotherapy, but it does knock down your immune system a little bit. So as the weeks go by, so week one, I'm on it, and then week two, I'm still on it. Towards the end of week two, I might start feeling just a little tired. And then week three, so it's 3 full weeks of being on Ibrance. And by week three, I don't know, I'm usually pretty tired, or I'm not too emotional or anything, just kind of tired. I can take lots of naps during that week. I might go to bed early, sleep in a little bit later. It's just kind of a tired week. Um, so on week four, I stop. No more Ibrance. Keep in mind, I'm still taking the Letrozole. That doesn't get breaks. But Ibrance, I stop. They give you a week off of Ibrance because you need that to regain your lymphocytes, your white blood cells, right? So they give you a week off and you drink water and eat good food. And towards the end of that week, I go in for an appointment. I can link to it below. Uh, I- they have me go in for an appointment at the cancer clinic, the local one right here in town, and I go there to see. Well, first it's kind of 3 appointments in one. So first there's a blood test, so I go in for lab work and I get the blood drawn, and then they have me wait again for my appointment, and that's usually with my physician's assistant or sometimes with the oncologist herself. And so she'll talk with me about how things are going, how I'm doing. My vitals are taken. They get my weight, my temperature, all that, blood pressure. And then she listens to my heart, my lungs, because I have some cancer in my lungs. So they're making sure there's no, I don't know, like fluid in my lungs or whatever might be the problem, that breathing is okay. And then if everything checks out and everything's great, then they send me back to a different waiting room where then the nurse eventually calls me back for a shot of Lupron. So that's pretty much all there is really to say about the Ibrance cycle. That's so 3 weeks on and then 1 week off. And then during that week off is when I go to the doctor for this checkup and get my blood checked every month. And then I move on for the Lupron shot. All right, so Lupron is it's an injection. It's given to me once every 4 weeks right before I go back onto Ibrance. And this is another medication that makes sure that my body is not producing any estrogen. So it's shutting down my estrogen production. And between this and the letrozole, uh, that is forcing me into menopause. And there's so Lupron essentially is not only used in cancer treatment. I believe that I've also heard of it used in like in vitro fertilization treatments and so forth. It's a hormone injection, so it's a pretty powerful medication, I would think. But this also, because it's every 4 weeks and I have to stay on it, this kind of tethers me from traveling too much. I have to stay on the schedule, and Lupron is definitely part of that schedule and part of that cycle that I have to remain local in order for me to get it. And I've never really talked to my doctor about ordering it somewhere else, if I could get it somewhere else exactly, but this is not an injection to take with me because it needs to stay at a certain temperature and so forth and all of those things. So I mainly have only had it here. And so those are the medications that I've been taking for about 2 years during my cancer treatment. And again, this is to treat metastatic breast cancer, invasive ductal cancer stage 4. And that's pretty much all the medicine I've been taking for that. So, all right, thank you for listening. And if you have any questions, please feel free to leave them in the comments below. I'm also really curious to hear from anybody else that's been on any of these medications. I also want to say that this is not a sponsored video at all. These medications are working great for me, but I don't want anyone to think that I'm saying this on behalf of anyone else. This is just my personal experience with my personal chemo cycle. So I just wanted to share that because other people might be curious to know what it's like living with metastatic breast cancer. And truth is, probably like week 3 is the most tiring part of it. And I don't really have too many complaints anymore. But like I said, if you have questions, if you have your own experiences that you'd like to share, I would love to hear about that in the comments below. Also, if you want more updates about my condition and about just life with breast cancer, feel free to subscribe. Thanks a lot. Have a great day and be kind to yourself and others. Bye.